What led you to get into healthcare?
Well, I had to think about this, but when I was 11 years old, I was at a football game on a Friday night, and I slipped on the bleachers and I broke my hip. And I ended up in St. Elizabeth's Hospital as a patient, and I had a spica cast on, and I was casted for several months, and that cast goes from your foot to the top of your chest. And they had to flip you and roll you, and it was very interesting with a bar between your legs. So my partner in my room was a girl who was recovering from some problems that she had post-polio. And so I ended up sort of being a caretaker for her, and I watched the nurses, and then I realized that's what I wanted to be when I grew up. I'm sure you're aware that Western Reserve Care System and Forum were having financial problems. And in the year that I was downsized in 2004, there were 17 other administrative people let go, and I was the last one that year. And then I looked for several months for a position because I wanted to be involved with growth. And I would have never even thought about pediatrics, to be honest with you, but the opportunity came up, and they were coming to the community, and they wanted to grow. And at that point, you know, healthcare was involved with so much downsizing and laying off people and closing programs and buildings. I had just gone through that for the last 15 years, so I wanted to do something that was new and exciting.
What led you to go into leadership administration?
As I watched things change in the hospitals, and I saw that there were opportunities for nurses to have better education and better support, I decided that if they had a leader who had worked in the field, who would better understand their needs, that I would be able to help them more. So that's why I decided to go into leadership.
How would you say the field has changed in the 15 years that you've been with Akron Children, or even just the years that you've been at this campus?
Well, when I came to Akron Children's, majority of the programs were housed in the Akron and Summit County areas. And so they had the hospital, and then they had many what we call primary care offices in the surrounding community. That was about the time that they were starting to focus on regionalization. So Akron Children's was taking their services into other hospitals in the Akron area, at SUMA at that point, and Akron General, and they were going to bring services here with our special care and our neonatal nursery. And so they were coming into hospitals and delivering specialized care that was very expensive. You needed very special staff, and many of the acute care or adult hospitals could not afford to do those services. So that's how we first started to branch out. And then we realized, as the world continues to change, that nobody wants to pay for inpatient hospital care. And so there are many things now that we provide in an outpatient setting. So Akron Children's then started to add more pediatric offices throughout the state. We actually have 7 here in the Mahoning Valley. And we started to bring specialties to the community so they didn't have to travel. I have to say that Mahoning Valley is a big family, and I'm very proud to have been part of it, and I've been very proud to be able to work here and to make contributions and to help children get better care in the community. And I have to say that it's a wonderful place to live, and if people really want to improve their lives, I think the opportunities are here, and I think people do care and will help you along the way.
For over a century, Farmers National Bank has stood strong. Through booms and busts, peaks and valleys, we've learned to know the seasons and how to grow in each of them. During challenging times, everyone is reminded of the value of solid relationships in both life and business. Farmers, stand strong.